facing my 60th birthday in 2 weeks, and I'm looking forward to looking as young as I feel, as a lot of women say, but this time I really want to do it, and I'm looking forward to it. In the first initial consultation with the doctor, he sat me down and asked me what it was that I was looking for improvement. He then brought out rulers and was definitely looking at what he thought he could improve. It was a fascinating process. I felt like I was with a sculptor getting ready to make his plan. He actually does computer imaging, so he was able to show me what he was planning to accomplish, and it was very exciting. He took a lot of pictures of every angle. He uses those in the operating room, I understand, to refer to. I'm probably a little nervous. I feel like I'm in the best of hands. The whole team here are probably the best in the area. I know this from other patients. I've been able to see a lot of his before and after pictures of patients that he's done. I know that I'm going to get a great result, so I'm not really nervous as much as I am just really excited.
Now we're going to approach the preoperative markings to establish our plan during surgery. And as you see from here, the forehead shows britids that are going horizontally across, as well as wrinkles around the corrugator muscles between the eyes. Our goal is to soften these lines as well as bring the eyebrows upward. She's had a blepharoplasty in the past, so most of the skin that you see is from the brow. So by elevating the brow up, the skin in the upper eyelid is basically gone and creates a nice natural crease and a nice natural appearance. So the wrong thing to do would be to excise the skin from the upper eyelid. This would look unnatural. And as we see, as we lift up in this location, we see a nice natural arch and a nice natural upper eyelid with our crease. This is the region in which we will tend to reduce the amount of animation between the eyebrows so that her squinting is reduced. In reducing it, we do not want to eradicate the animation completely, but we want to reduce it so that the squint lines between the eyes are reduced and has a much more youthful appearance. The squinting action that is seen here will be reduced by scoring the musculature that runs up and down, causing the creases. The corrugators are cut in this location through the endoscopic brow lift. The goal here is to rejuvenate the forehead and the areas between the eyes, giving it a smoother look. And when we do this, we find that we get a much more natural appearance. The lower eyelids will be lifted up and outward to give it a much smoother consistency around the lower eyelid. We see small fat pockets that are in the lower eyelids. This is now the markings for the scoring of the musculature that we discussed. She wears her hair back, and therefore we want to make sure that our incisions that we see are within the hairline and is separate from her part. We're drawing these lines to better delineate our pull.
Well, I review the record, speak with the patient, make sure that they're fit for surgery, for this is the proposed operation, evaluate them medically, preoperatively, and then during surgery, while the surgeon is focused on doing the procedure, I look overseeing the general medical care of the patient during the procedure, and after help manage their pain issues, any other issues that might come up medically. You feel a little pressure. I'm just going to put the IV in.
These are pictures of her in her 20s, 30s, and her current pictures. And the goal of these photographs is to help recreate her youth as she used to look and not try to create a new looking person. And as you see, there's many pictures here that we use in our operative planning to help guide us through our surgery. I refer to these pictures very often. Here is a photograph of a computer image of her nose on the left and a computerized image of it afterwards on your right side. This is our goal and what we hope to accomplish, and this has been discussed with Janice in great detail. But by doing this, I have very precise measurements as to what we will take off, how much we will take off, and in what areas. It gives us a very precise way of doing this. And as you see from this picture, there's various angles and measurements that we have measured on Janice and the measurements, etc., that we want to accomplish. On this diagram, you see the amount of dorsal resection of her nose in millimeters that you see from the top to the middle to the lower portion of her nose. And this is used to, again, help guide us. And this is done with the face and with the brow as well.
She's got the kind of like arms. Would you remind us to switch the gloves here?
Oh, for being too long? Oh, okay.
You have to be careful in this area.
What,
You might want to reposition that.
wait, I'm gonna give you your...
Our procedure started here with the upper eyelids or the lower eyelids that are being done, in which a small amount of skin and fat is resected under microscopic animation. And then we are doing her rhinoplasty and resecting the planned amount of dorsal resection. The facelift is started, and the skin is elevated from the neck and the facial area so that it can now be repositioned. This is the fat that's been taken from the abdominal area that will be used with the fat injections of her face so that we can recontour the curvature of her face and not just tighten her face in a flat orientation. This is a graft that's taken from a previous breast augment scar that we're using to do lip augmentation. The endoscopic brow lift is being performed, and the endoscope goes in underneath the skin, and as you can see, this is the internal components of the brow area down where those corrugators that I explained that we excise to reduce animation in that area.